Hello, my name is Barry Murphy-Jones and I'm an advanced paramedic with East Midlands Ambulance Service. I was a member of the Guideline Development Group for the latest review and update of the sepsis guideline, which sits in the medical section of the JLCalc Clinical Guidance on the JLCalc Plus and the iCPG apps. I'm also the paramedic representative for the NICE Sepsis Committee Guidelines. So this guideline has been fully reviewed and updated and includes a new diagram showing sepsis as a continuum of an infection and clarified some of the pathophysiology within the sepsis disease. We will continue to use NEWS2 as an assessment aid for any patient presenting with signs and symptoms of an infection, but just to remind you that this should not be used for any patient under 16 years of age or a woman who is pregnant up to 4 weeks postpartum. We've introduced some new clearer tables on the risk stratification, and these are also colour-coded to make it clearer to use. One important point to be aware of in this update is that we are not advising any use of pre-hospital antibiotics for suspected sepsis. The current evidence is not robust or conclusive enough to make this recommendation. There has been clarification on the use of the fluid resuscitation. The fluid of choice remains crystalloid, which will be sodium chloride. The treatment now should start at 250 ml boluses in adult patients prior to transportation to hospital, which can be continued en route if needed. However, this should not delay any time on scene. This can be repeated up to 1,000 ml of fluid, and if the patient remains hypertensive at this point, we would suggest that you may consider more senior help on scene, such as enhanced care team or critical care. If not available, then continue to hospital as soon as possible. It has been updated based to align up with the NICE NG51 sepsis guidelines that has been recently updated and continues to be updated at the moment, with further publications due later this year. The guidelines have been updated to match these recommendations of NICE, and we hope that the guidelines are clearer on the expected treatment and management of patients, including when to administer oxygen, start fluid resuscitation, request senior support, and provide time-critical transfer to hospital.